talk to us, if you could, what is TB?
Okay, TB is an airborne disease. It's spread when somebody with active TB coughs, sneezes, sings, things like that, things that produce sputum that could potentially be put up into the air. It's a bacteria. Usually affects the lungs, can affect other parts of the body as well.
What does it do to a person?
Basically what it does is once you breathe in the TB germ, it goes into your lungs, and from your lungs it can spread in your bloodstream to other parts of your body. Your immune system recognizes that this is something that should not be there, and so your immune system kicks in and tries to kill this substance, this bacteria. When that happens, the enzymes that are released can cause damage not only to the bacteria, but also to portions of your body. So that's what happens in active TB disease. It's important to note that just because you breathe in the TB germ does not mean that you're going to have active TB disease. It's called TB infection. Most of the time when somebody breathes in the TB germ, the immune system is able to wall it off and put a shell around it. And the germ lies dormant in there for most people their entire life. They're not contagious, they're not sick, they can't spread it to anybody, things like that. But about 10% of the time, if it goes untreated, and people just don't know they have it, so they don't take the appropriate preventive therapy, then it can wake up and start attacking different parts of your body.
And when you say attacking different parts of your body, I mean specifically, what are the symptoms? Is it physical that you see?
Sure.
Is it visual? How can you tell if you have something?
Okay, the majority of the time, what happens is people start having fevers, night sweats, weight loss. Depending on where the TB infestation is in your body, you'll get different symptoms. Most of the time it's in the lung, so you'll start coughing up blood, things like that. If it's somewhere else, say in your bone somewhere, then you will start having problems, like let's say it's in your knee. You'll start having knee problems. They'll probably do some surgeries to try to figure out what's going on, things like that.
When you talk about the symptoms, once the symptoms are detected, talk to me about the testing and what goes on, the series of tests that are conducted.
Sure. This, again, depends on where it is in their body. Let's just take the lung because that's where it typically appears. People start feeling sick. They start having those symptoms of coughing up blood. Usually what happens is they will get a TB test, either a skin test or a blood test, and that will come back positive most of the time. Then they will be sent for a chest x-ray. If the chest x-ray shows something that's abnormal, it doesn't define whether it's TB or something else, but if there's any abnormality on the chest x-ray, then we begin collecting coughing specimens. These coughing specimens are then sent for a couple of different tests and can take up to 8 weeks for those results to be finalized.
Okay. Can you talk a little bit specific about this particular investigation at Roosevelt Elementary School? I know you can't talk specifically about the person involved, but what led you to where you're at today?
Okay, I think a lot of people might wonder why, if this is a suspect case, why are you even starting an investigation? What happens is we have enough evidence to believe this is very likely that it is an active case of TB. Because of this person's circumstances, they go to school, they're around other children, they share a lot of that same airspace. We are being very liberal in our contact investigation. Typically, a contact investigation starts with just the closest family members, the person's father, mother, daughter, things like that. And then if any of those people show that transmission has occurred, then we expand the search to friends, coworkers, things like that. But because of this situation, we have decided to begin with a much larger group than we typically would. That's the student's classroom and the student students that ride the bus with this person. And even though we do not have an actual for sure diagnosis, we want to get started as soon as possible rather than waiting 2 months, because it's very likely that this person has TB. And we want to optimize our resources and quickly and efficiently get to the point of, was this person infectious, and if so, who did they infect, so we can get them on the appropriate therapy and stop TB transmission before it occurs again.
What is the history of TB in the Spokane area for the year, on an average typical year?
Sure. On average, we have about 8 cases. Not all of those are pulmonary TB or TB of the lung. There's also extrapulmonary cases which are not infectious.
For parents that are going to be watching this story at some point today, what kind of advice would you give them?
My advice would be, go along with this testing. In a contact investigation, we test right away, right